In the heart of Uganda lies Jinja City, where a silent battle against mental health stigma is being fought. But amidst the noise of everyday life, a quiet revolution is taking place, led by those who have dared to share their stories. Mental Health Uganda, in collaboration with Voice and other Jinja City local partners, has pioneered a groundbreaking approach known as social contact.
The project is normalizing mental health conversations, and we received support from Voice Oxfam. But we have also been able to receive invaluable support from the Jinja City local government, especially the Office of the Mayor and the Town Clerk, the DHO.
Social contact, these are casual conversations. They are just informal, like they are not organized as such.
Social contact is when a champion meets a stranger on the road or wherever she is, and I'll introduce myself to her or him and start talking about mental health and mental illness in my local language or in the language that that person understands. Social contact has been so beautiful that it has changed the way people think about mental illness, because they are using me, who has gone through it, to talk.
These are conversations between a person with a lived experience of mental health illnesses and who has disclosed with a community member who could be going through a mental health challenge or not. And in these conversations, the champions use their stories to inspire the community member or the people that they come across to disclose, and thus also be able to access services for those that could be facing mental health challenges.
The social contact approach involves conversations between individuals with and without mental health conditions. This method is effective in addressing stereotypes, prejudice, and negative behaviors associated with mental health issues.
Mental health social contacts are very good in normalizing mental health issues or mental health conversations. Before we came to the community, or even before mental health approached us, we didn't have the energy to discuss our personal stories with people, or to tell people that mental health is really within us and we can easily fight it slowly by slowly through conversing with each other.
During social contact, the champions not only listen or speak with the community members, but they also offer support in a way that they will psychoeducate. They offer psychological first aid in terms of normalizing the clients, and then after they are able to link those that may be in need of psychosocial support to our toll-free number, the MHU toll-free number, and then also some are linked to the different treatment centers within Jinja City, where they are able to access services.
Through candid conversations and shared experiences, social contact aims to break down the barriers surrounding mental health and foster a community of understanding and compassion.
So the social contact events have happened for 15 months in Jinja District, Southern and Northern Division, and we mostly target areas with many people, places like markets, social events like football events, something like that. So we talk to the people about mental health, mental illness, the causes, and this is basically to normalize the conversation.
Social contact is effective in addressing stigma in communities.
Stigma, it can be internal. You yourself, you can stigmatize yourself because of how you see people looking at you, or it can be the way the community looks at you. The community can stigmatize you if they realize that you're suffering from a mental health issue. This tortured me so much to a level that I almost died by suicide.
If you have a mental illness, bakuloga. Most people believe that it's witchcraft.
Nayita mu kusosolebwa abantu balina amannya ge bayita abantu abalwadde b'emitwe bamawunvu mawaya.
In our community, they look at someone with mental illness as a curse. I had to sit even before the elders and be prayed for the curse to leave me.
Ngashitera kujanga ndi mu leisure time. Then nenyenya just mutwe wait. Bakije wange nagamba ejo mizimu. Ba neighbors nga bagamba nti oyo mwana yafuna emizimu kati nga ne kusomolero wentula mu kilasi bagamba oyo wa mizimu jijja mukwata. Ndi musanyufu nnyo kati kuba nze gwe bali basekerera nga nsoma. I was in P5 kati ndi namala senior 4 nenku kati nkola general nursing kati mpulira n'essanyu ngenda fuka nurse ate nzijanjabe n'abalala.
By facilitating open conversations and dispelling myths, social contact creates a safe space for individuals to seek support and guidance.
What social contact has done is to get mental health out of the shadows, to demonstrate to people that you can ably discuss mental health and mental health problems in a public space.
Social contact zino zituyambye waliwo ko reduction in stigma. Tufunye reports nti abantu batwala abantu ki mu ddwaliro.
To normalize mental health conversations, we employ a community champion model. These are selected individuals who have overcome stigma, sharing their stories, fostering openness, and creating a supportive environment.
These champions have been trained on how to identify mental disorders, how to do simple counseling.
We are able to train 24 champions in Jinja City. These champions are not merely, advocates of, mental health services, but they are more of beacons of hope because they're individuals who have gone through it. They are more of survivors.
Fenga ba champions omulimu gwaffe twogera ku bulwadde bw'obwongo oba obulwadde bw'omutwe nga twagala okufuula obulwadde bw'omutwe ng'emboozi eya bulijjo, normalizing mental health conversation. So tugenda mu community ne twogera n'abantu ne twogera nabo ku bulwadde bw'omutwe in case ne tu-identifyinga obubonero omuntu omulwadde bw'omutwe bw'alina we tuba tufunye tugaba ne referrals ne bagenda for medical attention.
These champions are not just sharing their stories, they're igniting a movement of change, one conversation at a time. The champions embody resilience and serve as advocates, breaking down barriers and fostering understanding within their local communities. In the journey to destigmatize mental health, every conversation matters.
The toll-free number has been our first line of referral. Every time you call that number, the agents are there to speak to you and also support you in any way that is possible.
Now, for me personally, I take the toll-free as the first aid that is given to someone because it works in emergencies. It works in time when there is confusion and you have nowhere to run to.
It is cheap, it is organic, it happens within a local setting. So you could start a conversation from whatever area you find a person. It's cost effective. It is a very powerful tool in increasing demand for services. I remember in the beginning we got a lot of feedback from the district that actually many people had started coming to the health facility to seek for mental health services. Another lesson we have learned from Jinja is that very many young people have mental health problems. They have a high suicidal ideation. Many people develop mental health problems because of alcohol and drug abuse. But we also saw that alcohol and drugs are used by many people with mental health problems as a coping mechanism. People who have been leading the conversations, who are the champions, were recruited from the communities that cover Jinja City, which was our main target. We also integrated the village health team, which is a government structure under the Ministry of Health that were already doing awareness creation in the communities. So what we did was to empower them with information on mental health, which they are now going to integrate into their normal routine. Since the project is now coming to an end, we have already started having strategic conversations with civil society organizations that are based here to see if they can integrate social contact, especially for organizations that are also targeting people with mental health problems.
This project has only looked at Jinja City, which is quite small. There are just 2 divisions. However, there are thousands of people that are suffering from mental illnesses. Other districts, national. How wish these conversations were moving all over the country.
We wish if it could be rolled out throughout the country. Because majority of our patients, majority of our communities don't have knowledge about mental conditions.
So kyandibadde kirungi egendeko ne mu districts endala.
It's prudent on government to invest more in community mental health services, and that's where conversations on mental health will be seen as normal, and it will be okay for people not to be okay. They will also activate the role of the family into the provision of care.
Together, let's break down barriers, ignite compassion, and build a future where mental health is embraced, not feared.